my beauties, and welcome to my YouTube channel. If you guys are new to following me, my name is Dr. Stephanie Kappel, and I'm a board certified dermatologist and fellowship trained laser surgeon and Mohs micrographic surgeon. And the reason why I do this YouTube channel is for my patients and my beauties and my followers who just want to inquire about different dermatologic procedures, questions about skincare, and I usually cover a topic each week on covering a topic that you guys are asking me questions about, that I'm seeing in my comments, or that I'm getting asked by my live patients when I work in my clinic every day and seeing patients every day, kind of seeing what you guys want to hear about. So today I decided to talk about neck rejuvenation, and the reason why I wanted to discuss this topic is because a lot of patients come in asking about different non-surgical options for improving the cosmetic appearance of their neck, whether they're in their 30s, 40s, 50s, 60s, and beyond. There's lots of things that we can do without surgery to help the cosmetic appearance of the neck. And last week I posted a video on lower face rejuvenation, and within those comments I saw some comments on neck rejuvenation as well. And so because I covered the lower face area, now I want to complete the job and discuss neck rejuvenation and not neglect this area, because it is an important area and you want your skin on your neck to match your face. And then be sure to follow and subscribe to my YouTube channel and hit the bell to get notifications for when I post a new video, as I post a new video every week. You can also find me on Instagram, where I post different stories every day on my morning and evening skincare routines, and I talk about my new skincare line that I just recently launched, and I also take you in the office with me and keep you in my pocket, my white coat, when I'm treating patients throughout the day, so that you can see treatments in real time and in real life and see the patient's experiences as well. So in my office, I primarily practice non-surgical interventions for rejuvenation. And when talking about neck rejuvenation, this is really important because the neck skin is so thin that as we lose collagen and elastin over time, we could start seeing bands in the neck, we can start seeing creases, horizontal creases in the neck, and we can see neck laxity. And this is all a result of collagen and elastin loss over time. So stimulating your skin's own regenerative processes to make that collagen and elastin not only tightens the skin and makes it look better, but if you are ever going to have a neck lift or neck surgery, your results will stay for a longer period of time, because as a surgeon, when you're suturing neck skin that doesn't have a lot of collagen and elastin in it, it'll look good for maybe the first year, but unfortunately gravity will take its toll and the neck will start to sag again unless it has that dense collagen and elastin constituent in the dermis as well. So most of these non-surgical treatments improve the cosmetic appearance of the neck by increasing collagen and elastin synthesis, and post-operatively or post-surgery, stimulating collagen and elastin will make the results of your surgery last longer as well. So when looking online, you can be overwhelming all the different non-surgical treatments that you can use on the neck, and it can be overwhelming. So my job is to kind of just guide you through the different types of treatments and how they work, so that you can pick a treatment that may be best suited for you. So starting with stimulant fillers. So stimulant fillers, unlike hyaluronic acid fillers, which basically correct volume, the type of fillers that we put in the nasolabial folds, the lips, the tear trough area, stimulant fillers like Radiesse, for instance, stimulate your body's own regenerative processes to make collagen and elastin, which help improve the cosmetic appearance of the neck. So usually using hyperdilute Radiesse, injecting it into an area where there's some laxity, or injecting it into what we call tech neck creases, can help soften those lines and help tighten the skin, with beautiful results that last about 2 to 3 years. Oftentimes, it takes about 2 to 3 treatments to get to your endpoint goal, and each treatment is spaced 1 month apart, and the results are beautiful and they're very natural looking, because you're basically inducing your skin to do the work, which always gives the most natural and beautiful result. Now, some of you may be asking about Sculptra, because Sculptra is also a stimulant filler that we use in the mid-face. We use it to add booty volume. We can use Sculptra for many indications to improve the volume, restoration, and to improve the texture of the skin. However, for the neck, it's actually not my favorite. I usually prefer Radiesse over Sculptra for neck rejuvenation, although I use Sculptra for other indications. I think that Radiesse performs best in the neck because it's a very even distribution of the filler, and the results usually are a little bit longer lasting, and there is less incidence of nodules forming. So that's always a caveat, and something you have to look out for with fillers. And that's another reason why we don't use hyaluronic acid fillers in the neck, even when they're hyperdilute and even when they're blended with other modifications like saline or bacteriostatic water. Hyaluronic acid fillers don't really do well in the neck because that skin is so thin that sometimes they can show through. So hyperdilute Radiesse is my go-to for an injectable correction for laxity and loose skin on the neck. So Another non-surgical option is our tightening devices. So I happen to love thermage as a tightening device, which is a radio frequency device that is used to put heat in the form of radio frequency into the skin to stimulate the fibroblasts to lift, tighten, and pull that delicate, loose neck skin. There's other energy-based devices like Ultherapy, Thermatite, there's many of them out there, but thermage happens to be my favorite, but that's not to say that the other energy-based devices don't work well. I think all the energy-based devices are beneficial because they induce collagen synthesis and elastin synthesis to improve the cosmetic appearance of fine lines and wrinkles and neck laxity. Just doing lasers alone will improve the texture and tone and appearance of the neck, especially if there's a lot of sun damage, if there's a phenomenon called poikiloderma of Savant, which is what dermatologists call the kind of splotchy, weather-beaten look to the neck and chest when there's like red and white and brown spots on the neck. That will be improved with a Fraxel treatment or an ablative or non-ablative resurfacing laser. So helping resurface the skin to make it look better on the outside also stimulates collagen on the inside to improve the appearance of neck skin as well. And another non-surgical treatment to improve the appearance of the neck is Botox. So Botox can be used for a multitude of things. It can be used for treating the horizontal neck bands, which we call tech neck creases, which not only occur with age, but also can be an anatomical variant that we see in very young patients too. Even as early as our 20s, sometimes there's an anatomy, their neck anatomy sets them up for having these creases that go horizontally against the neck that could be cosmetically bothersome. And doing small little droplets of units of Botox along the crease will help minimize the appearance and soften them significantly. Another use for Botox is for treating the platysmal bands or the neck bands that can occur in the neck. So sometimes to relax that platysmal band, we do Botox in the bands or cords of the neck to help smooth it out, and that gives a very beautiful appearance. And the results from Botox usually last about 3 to 6 months. Now, another non-surgical neck rejuvenation treatment is Kybella. So Kybella is an injectable fat-dissolving solution. It's deoxycholic acid, and it's usually used to treat the submental fat pad that's underneath the chin, which we refer to as the double chin. So the caveat to Kybella is that you get about 1 to 2 weeks of some significant swelling, so things can get a little bit worse before they get better. But then about 6 to 8 weeks after treatment, you can notice the retraction of that fat pad back, and the fat is usually dissolved and resolved. An important thing to remember though about Kybella is that there's a lot of under chin or under neck laxity. With removal of that fat, that laxity can get worse, so that's something to consider. So if someone has a lot of fat and loose skin, usually we'll have to combine Kybella to melt the fat and then thermage on top of it to tighten loose skin. In younger patients with really good elastic recoil back in their skin, usually we just do the injections to melt the fat, and their skin will retract back pretty well on its own. And last but not least, there's Pvo Threads. So thread lifts of the neck give a really beautiful, amazing result. Usually the thread lift results last about 2 years, and it's something that we do very commonly in our clinic, and it's for people who don't want surgery, who want to prolong surgery, or not at that point yet. And it's great because the Pvo Threads themselves are almost like string-like filler in that it stimulates your body to make collagen and elastin and to tighten the skin, and it also mechanically lifts up and pulls on that lower neck skin to help make it look tighter and smoother. And so patients really love the thread lifts because it takes about 30 minutes in the office. There's little to no downtime, and it's not painful. There's no scars, there's no scar tissue, and it's a preferred method over a neck lift or surgery. And as with most procedures and treatments in the office, it's very operator dependent. So if you look online and you see negative things being said by Pvo Threads or thread lifts, it's usually from a plastic surgeon's office who would rather have their patients in the OR and performing surgery on them, or usually it's a bad outcome or side effect from the Pvo thread lift that was done by a non-skilled provider or someone who was maybe not a surgeon or didn't understand their dermal planes or anatomy very well, because it's highly operator dependent, and when it's done correctly, it has a beautiful outcome with little to zero complications, and patients are really, really happy and usually love their results. So these are my treatment recommendations for non-surgical options for improving the texture and appearance of neck skin. There's probably many more that I failed to mention today, but these are the ones that happen to be my favorite, that have the best outcomes and make the happiest patients in my office. So I hope that you find this useful, and let me know in the comments what other topics that you guys want to hear about. Thank you for watching.